Good evening, everyone. So once again, Thursday evening, we are here together, and today we are going to discuss about the stress and depression in children with special needs. So we need to first understand the stress. Many of us don't even talk about it, that children with special needs also go through the stress and depression. So this is going to be this session we have divided into two sessions. One is today, where we are going to actually analyze and understand the stress, that yes, the stress exists, and not only at the childhood age. Special needs, be it autism, ADHD, or other special needs, intellectually special needs, we have stress at different levels at early childhood, at the schooling, preschooling, schooling, college, or at the workplaces, handling relationships, handling friendships. Different types of stresses are there that a person with special needs has to go through. So today, in the first session of the same topic, we'll have two sessions, as I said. So today I'll be walking you through a child's journey where we'll just realize the stress they go through. And then in next Thursday, we will talk about, in detail, we'll talk about the rectifications in the environment, what parents should do, what therapists should do, what teachers should do to make sure that child gets the subsequent support and stress in those children or those people with special needs is limited or minimized. So the strategies majorly we'll be discussing on the next session, and today's session is going to be little bit more about realizing the stress they go through. That is also very important. So let's begin. I will just start my presentation. So understanding stress and depression in children with special needs. Little bit about the organization that is conducting these sessions, JKP Care Foundation. So JKP Care Foundation is a registered non-profit organization working for the special needs. We are working for training the parents and professionals. We are working for providing support directly to the children and adults with special needs. And we are also working towards the environmental corrections. So we have many projects which are going on. Aspire is one of the upcoming project, which is starting from 1st of April. Admissions have started. So this is Aspire is the autism schooling program, global schooling program, which follows the NIOS curriculum. First time in India online. So it's for the children who are not able to cope up with the classroom structure, for the adults who are not able to go to the regular schoolings or special schools, even because of their diversity and because of the challenges they have. So with the help of parents, with the help of therapists and special educators, we are conducting the online schooling for that. For more details, you can visit us www.jkp.ngo and visit the page Aspire there. Admissions have already begun. So any parents who are looking forward for the online schooling for their children with special needs, majorly with autism spectrum, can connect with us. So before I begin, I just want to share this fact with you. Children with autism spectrum disorder are approximately 4 times more likely to experience depression when compared to typically developing children. So when compared to the other children with autism spectrum, they experience depression, stress approximately 4 times more than that. And the challenge is we are not able to recognize. We live in a society where mental health itself is taboo. So even for the adults, we don't care much about their mental health. When it comes to stress management, it leads to depression. Subsequently, it leads to other further more severe conditions of the brain. but we don't talk much about it, even for the adults. And for children, nobody talks about depression in children. But this is the reality based upon the research. The reality is that children who are on spectrum, they face 4 times more challenges than the neurotypical children when it comes to stress, depression, or mental health. Now we keep on providing them therapies for their behavior modification therapies, ABA therapies, occupational therapy, speech and language therapy. But if there are underlying stress, child is not able to perform. And then therapists come to me and say, sir, I have been trying, I've tried this strategy, that strategy, but child is not developing, child is not responding. So we need to evaluate the environment and understand the stress they are going through. Make sure the environment corrections are taken place. Parents have been educated about it, and we handle the stress first. Therapies can go hand in hand. I'm talking about not the stress management therapies, but the other therapies. So today I'm going to walk through a child's life. Child name is Chino. Chino is a child who is on spectrum, and I'm just going to walk through what all Chino goes through. So you need to be with me, you need to visualize, feel the struggle this child is facing. And story is the same for all the children who are on special or on spectrum or who are with special needs, somewhat or the other story is similar. So Chino's world, let's just listen to this tale, a strange tale, Chino's world. From Chino's mouth. So Chino says, before I had words, when I was born, much before I started speaking, much before I had words. So my name is Chino, but before I knew my name, before I could speak, there was already something different about me. I don't remember my birth, but I have been told I cried a lot, too much, too loudly, not like other babies. They said I was sensitive. I think I was overwhelmed. 0 to 2 years, the world was too much for me. 0 to 3 years, sorry. So I did not like being touched suddenly. When people picked me up, I often stiffened. When relatives tried to cuddle me, I would cry. The lights were too bright. The sound were too sharp. Pressure calmed me, but nobody knew that. My mother tried everything. Doctors said he's just a little delayed. But my mother knew something was different. Silence that spoke from 3 to 5 years. Other children started speaking. I didn't. I could hear everything. I could understand more than they thought. But words didn't come easily to me. Sometimes I repeated sounds. Sometimes I stayed silent. People said he doesn't listen. But I was listening to everything they said. I was listening too much actually. Between 5 to 7 years, my own world. I liked patterns. I liked spinning wheels. I liked watching shadows. I liked things that didn't change because everything else did too fast. When routines changed, my whole body reacted. I screamed. They called it a tantrum. For me, it was panic. 7 years old, the beginning of awareness. By the time I was 7, I started noticing something. I was not like other children. They laughed easily. They spoke freely. They made friends. And I just observed them. Mornings that hurt me, mornings were not gentle to me. The fan noise, the brushing, the textures, they bothered me a lot. Everything felt intense. I didn't know how to say this hurts. So I cried. And they thought I was being difficult. I was being stubborn. Handling me was difficult. At school, school was a battlefield for me. School was confusing. I knew answers, but I couldn't say them. My mind would freeze when everyone looked at me. Teachers thought I didn't know. Children laughed at me. I learned something important that day. Silence protects you, but it also isolates. So, how isolated I was in the school. At friendship front, a language that I didn't know. I wanted friends like other children. I also wanted friends, but I didn't understand the rules. When to talk, how long to look, or what to say next. Conversations moved fast, but my brain didn't. So I stayed behind. Between 10 to 13 years, emotions without names. I started feeling things more deeply. Sadness, frustration, loneliness, but I could not label them. If someone asked what happened, I would say, I don't know. But inside, there was a storm. The anger, nobody understood. So Chinu here is talking about his life's whole life stages, how Chinu has felt. So when everything became too much, I exploded. I shouted, I hit, I broke things. They called it a behavior. But it was not behavior, it was overload. For me, it was just overload. They called it behavior and started working on behavior modification. Started giving me therapies of handling my behavior or started punishing me for my behavior. It was just overload of all my frustration, all my stress that I could not explain to you, all my feelings, emotions that I could not understand myself, stress of not being able to make friends, stress of not being able to connect in the classrooms, in the school, with my fellow mates, with my teachers. At puberty, 13 to 16 years, that was very confusing change for me. Something new began. My body changed. Feelings appeared that I didn't understand. Something my heart raced for no clear reason. Sometimes my heart raced. Heartbeat became faster for no reason, no clear reason. I didn't know why it is happening. Sometimes my body reacted in ways that I couldn't control. And I was scared. I was scared of this change. Then comes the attraction, a silent question. There was a girl in my class. When I saw her, something felt different. Warm, nervous, confusing. Was this friendship or was this something else? Nobody had explained this to me. I didn't have words to go and ask people. I didn't know how to ask about it. And I was confused. This question was with me. These questions were bothering me. Mistakes that were not intentional. Sometimes I stared too long. Sometimes I stood too close. People reacted. I'm talking about my age between 13 to 15 years. People said, don't do that. But no one told me what to do instead. If I don't do this, then what to do? Nobody has explained this to me. Learning social rules late. I started observing more carefully how others talk, how they smile, how they stood. I copied them slowly, awkwardly, and imperfectly. So I tried to copy social rules from the fellow peers, from other children or other elders who were involved with me. But it was very late. Sometimes I could copy, sometimes I could not copy, sometimes it was imperfectly I copied. Late teenage years, 16 to 18 years, I had my own identity crisis. I began asking myself, who am I? Why am I different? Why is everything harder for me? There were no clear answers, only more questions. From my environment, from people around me, they were just questions for me. But nobody understood this struggle which I am going through. Nobody answered me, who am I? Nobody answered me why everything is harder for me. Why don't I align with the norms and rules of the society? There were no clear answers given to me. At college, a new kind of struggle began from 18 years to 21 years. Everyone said college will change everything. It did. Yes, it did. It became harder. Too much information, too many people, too many expectations from. I understood concepts, but couldn't express them. And then I started feeling the loneliness in crowds. I was surrounded by people, yet I had no one. I wanted to talk, but starting a conversation felt like solving a puzzle with missing pieces. I didn't know how to initiate a conversation. I didn't know how to talk, how to start. So I had no one around me. There were people around me, but no one for me. So within the crowds also, I was lonely. At relationships, the one that never began. There was someone I liked. I planned, I rehearsed conversation in my head again and again. I'll go to this girl, I'll say this, I'll talk this, I'll say this. But when the moment came, I said nothing because I didn't know how to initiate. She walked away and I stayed silent. Decisions, the hardest task. What do you want to do in life? I didn't know. Too many choices, my brain froze. Even simple decisions like choosing food felt overwhelming for me. Simple decisions, when I go to a restaurant, you ask me to choose a food from the menu card. There were so many things, too much of information, and then the sensory overload in the environment. I was overwhelmed. I was not able to take my decisions. Early adulthood, 21 to 23 years. Now the expectations from me were increased. Career, responsibility, independence. But I was still figuring out how to manage daily life. I still had those challenges. Remember the challenges I had in my early childhood? The noise of the fan in the morning, brushing the teeth in the morning. So I was still struggling with those challenges where expectations from me were career, responsibility, and independence. Understanding myself, 23 to 25 years of age, slowly I began to understand I am not broken. My brain is wired differently. I process differently, I feel differently, and I respond differently. Then came the acceptance. I stopped asking, why am I like this? And started asking, how can I live with this? How I can manage myself along with this? Yes, I'm Chino. Now I'm 25 years. I still struggle with noise, with emotions, with relationships, with choices. But I also notice details other miss, feel deeply, and think uniquely. And my truth is, I'm not strange. I'm different. And that difference is not a weakness. That difference is my power. So if you meet someone like me, be patient, be kind, give us time, because behind the silence, there is a full story waiting to be heard. Yes, I'm not able to narrate that whole story to you, but I expect you to listen to my story, not with my words, with my gestures, with my tantrums, with my meltdowns, with my behaviors. I expect you to understand the struggle I am going through. Yes, I'm Chino, and I'm still learning how to live in a world that was not designed for minds like mine. So the world is not designed for minds like mine, and I'm still learning to adjust with this world. With this, I end the story of Chino. And now I want you all to take a pause. Connect with your own children, or if you are a therapist, connect with the children whom you are providing therapies. If you are a teacher, connect with those children whom you are teaching. Children with autism, children with special needs. Try to relate this story with them. So Chinu's story is not Chinu's story. Chinu's story is the story of all those children whom we are handling. And it is more deeper. I have tried to summarize this story in just few slides with one or two examples at each stage. But that's not whole. Every day I go through this struggle. Trust me, this struggle these children face, any one of us, you and I, if we have to face those struggles, we will go mad. Will not be able to handle. We all will become stressed. We all will become patients of depression. And then stages will continue. And the stress directly impacts our learning, our skills, our outcome, our brain processing. It directly impacts. So stress in autism. Children with autism, as I have told you already on the first slide, are 4 times more prone to the stress, to depression. But they experience the stress differently. Even small changes in routine or environment can overwhelm them. Stress may not always be verbalized, but shown through behavior. So they are not able to explain their stress. They are not able to understand their stress. It's we, the caregivers, need to understand. Much before the child actually goes through that stress, we need to do the analysis of the environment and support them, create the support system for them so that they don't have to face those struggles. Many of us, we treat children in a way that they don't understand things. But as Shinu said in his story, at early childhood itself, he was listening, he was observing, he was connecting with what you were talking. Just because they are not able to express, we consider them that they are not understanding. So they understand. They feel your emotions. They feel the stress around. Now, these were the internal stress of Chino. Think about the external stress that we are giving from the environment. I am raising a child who is with autism, who is on spectrum. From morning till evening, I keep on talking about that child. The child is center of attraction for the entire family, neighborhood, school, because the child is different. And what do I talk about the child? 80% of the time, I'm talking about my own struggle with the child. 80% of the time, I'm talking about the challenges this child has and the challenges I am facing to handle, raise this child. All that child is listening, remember, all those things he is understanding. When your neighbor walks into your house and you say, oh, I have not yet completed my daily course. I have not yet taken shower because Chinu has kept me occupied. Oh, Chinu started crying today badly. It took me half an hour to cool him down. And Chinu feels guilty of making the mother struggle or making the father struggle. Yes, we are, by discussing this to our neighbor, to our family member, we are releasing our stress. Fine. But the other side, Chinu is understanding. When parents, husband and wife, they blame each other, they fight with each other, all that stress travels to the child. When other children don't play with me, when other children sideline me or ignore me, that stress travels to me. When my own mother just gives me a toy to keep me occupied and gets busy gossiping with the neighbors, that stress travels me. When my own sibling goes out to play with friends, when siblings' friends come home and then they play and they ignore me, that stress troubles me. When you drop me in the school, when the environment shifts from home to school, attention to group attention, that stress bothers me. I do not know what time the school is going to be over. I do not know what is there at home for me after the school, whether my mother will come to pick me up or not, whether I'll go back from school or not. Am I going to spend my whole day in the school or whole night also? Am I going to spend my rest of life in the school? I do not know. Nobody has told me. Or even if they told me, I was failed to understand that after school hours, I'll go back home. So the transition of places bothers me. This is what a child goes through. If you and I, any of us, have to visit for our own treatment, for God forbid, may God bless all of us. But if we have to visit every day, 2-3 clinics for therapies here, there, somewhere we are going for OT, somewhere we are going for speech, somewhere we are going for behavior or other consultations or physicians visit. So frequently I have to visit the clinic environments. If you and I have to visit doctors like this, we will surrender within 1 week, 10 days or 15 days. We will get stressed out. So think about a child, a small child, 3 years, 4 years, 5 years. The struggle this child is going through. And struggle of what? Struggle of not my own mistake. It's not something that I have created. Struggle of accepting your society norms. Your norms of society which are not made for me. My brain is wired differently. This society is not made for me. On top of that, this society is not ready to accept me also. So this stress lives with me right from my early childhood till the time I live. It does not end with childhood or adolescent. For every decision in life, every different stage, when I'm into the transition, the stress increases a lot. I do not know what next. I do not know how to handle this. I'm failed to understand my own emotions. I'm failed to understand why all other people are laughing. I fail to understand your jokes. I fail to understand what am I doing in this wedding party where there are a lot of lights and a lot of noise, sound, music that is bothering me, which I'm not able to integrate the information which I'm getting. I mean, the sensory system is not able to support it. What I am doing here? Why am I here? Because this music is not made for me. These lights are not made for me. So much of crowd, so many people coming and talking, and not talking one to one to me, but gossiping around. That also bothers me. So this is all a child or an adult, adolescent, a teenager goes through at different stages. We need to realize this. And trust me, if we are able to handle this, with my experience, I'm saying, if we are able to make corrections in the environment, create a supportive environment for the child, understand the child's stress and struggles much before they appear, prepare the child for them, give the answers to the child before even the child has questions in his mind. You have won 50% of the child. 50% of the behavioral issues, 50% of the developmental issues are settled. Trust me, I'm talking from my experience. So as soon as a child is diagnosed, okay, initially we see there is a developmental delay. Parents come to know, family members come to know, or through teachers, through school teachers, we come to know, and then we visit a professional, do a formal assessment of the child, and we get a report. Child is with spectrum. The whole world changes. Many parents have not even heard the word of autism, or many of them who are even aware about it, they never thought this could happen to their child. The entire world, harmony in the family is gone. They are stress around, and the whole stress, the environment is traveling to the child. For our stress, we have people to support, our friends, family members. They call us, we talk to them, and then they say no. And doctors are there to support us. They say, no, it's okay, not a problem. You're lucky. Usually we say that you are special parents. You are lucky to have this child. You can raise him. This is a journey. You will learn a lot in this journey. All these words, they soothe us. We feel little better. We connect with other parents. We connect with through social media, their parents group, mothers group, and they talk about their struggle. They ease out. Who's there with our child to talk about his struggles? Who's there with our child to support, to understand his emotions, to understand what is going on in his mind? And then the child starts showing the aggressive behavior or overwhelmed. Child is kind of stressed and shows tantrums or shows meltdown. And we start providing the therapies for them. We immediately start behavior modification therapies. This is not a behavior to be modified. The underlying cause of this behavior is the stress child is going through. So we need to handle the stress. We don't have to work on behavior modification for this at all. Now, how to understand child is stressed or not? Major challenge, especially in autism spectrum. Because the symptoms of depression, symptoms of stress or depression are like the symptoms of, they overlap the symptom with the symptoms of autism. So let's look into the signs of stress and depression. Increased meltdowns or withdrawal, sleep disturbances, loss of interest in activities, aggression or self-injury, and reduced communication. check these five major signs. There are many other signs, but these are the five major signs. Are not they already present in autism? So some or other time, most of the children who are on spectrum, they show us these signs. And now if the child is who's on spectrum has stress or going through depressive stage, will show these signs. How would I differentiate? Challenge is there. How would I differentiate that whether my child is showing the symptoms of autism or showing the symptoms of depression? And a child who is on spectrum, 4 times more prone to depression. Think about the situation. Yes, we can find out. Through a detailed environmental analysis, we can find out what is going on. There's a research which is not yet published. Research is still going on. And the research it has been done on a smaller number. Now they are doing it on a bigger number. And the research is about regression. Regression in autism. Is stress is the underlying reason for that regression? We all struggle with that regressive phases. Child has learned, child is doing everything, learning, and then something comes up suddenly, child loses interest. So child has started speaking three words sentences, and now suddenly child is back. Child has started doing some activities, now child again is not doing. That's exactly happens when we are in depression. We lose interest in life, we lose interest in activities, our appetite is compromised. Either it is too much of appetite or too less of appetite. Our sleep is compromised. Either we oversleep, or we don't sleep at all, or our sleep is reduced. Our functions, we slowly start shutting down our sensory system. So person who's with depression, what the person does? Person likes to be alone in the room. Person doesn't want to go and meet people. Likes to close down the sensory input. Does not like loud noise. Does not like bright lights. Wants to sleep most of the time. All of this, a child who's on spectrum starts showing this, and that we call as regression. So yes, there could be, I'm using the word could be, depression, pediatric depression, we should name it as, behind every regression, if we are talking about children. But regression happens in adults also. So there could be depression in autism. That could be the cause of regression. So we need to work on the environment, make corrections in the environment, and support our child with the environment. So why these children are on risk? Because difficulty expressing emotions, social isolation, academic pressure, sensory sensitivities, and lack of understanding from others. This is all of this are children are like, adults with autism, with special needs. All of them, they face most of these. They are socially isolated. They don't express emotions. They are not able to express their emotions correctly. They have academic pressure because they are not able to understand. The curriculums are designed not for me. They are designed for children who fall in the category of neurotypical children. Curriculum are not designed. The classroom curriculum I'm talking about. Sensory sensitivities I have and lack of understanding. If I am kept in an environment, in a world of people, like people around me do not understand me, do not understand my language, how long will I be able to survive with them? I communicate differently. Yes, I have words, but my words mean different. When I say water, maybe I'm asking for the juice. Because for me, juice is water. Or milkshake is water. Or when I say roti, maybe I'm asking for the chips. If my family members do not understand my words or my gestures, Whatever way I communicate, if they do not understand, I get stressed. And this happens with all of us. We all go through this. Our children go through these stages every day. In every task, be it smaller or bigger. Tasks which are small for us, which are easy for us, are very, very difficult for them. Just understand from a child's point perspective. A child who's with special needs. Child is thirsty, not able to tell us that I am thirsty, not able to understand that I am thirsty. Something is happening inside, but I don't know what's happening. And I don't communicate with you. I'm not able to tell you what is going on. What I do, the only expression I have is I start crying, or I start become agitated. I start shouting, screaming. And if you don't understand why am I crying, the intensity of my cry becomes more, because the thirst, the need, the urge is becoming more. That's troubling me more. And you expect me to, if I'm thirsty, you expect me to just go to the kitchen and drink water? Yes, I can go to the kitchen and drink water. You have trained me on this. Fine. But have you done the environmental analysis of the kitchen? The moment I walk into the kitchen, I open the drawer, the cabinet, to take a tumbler out of it. The sound of that drawer bothers me. I do not know how much pressure I need to put to pull the drawer correctly. Or I do not know how much pressure I need to put back to put the drawer back. And I put more pressure, it makes more sound. And then you shout at me. So everything I try to do on my own, you are there to correct me. Every time, from morning till evening. Then again, the same thing goes on when I open the fridge to take the water bottle out. The environment of the fridge inside, again, is very different. So how much pressure do I need to put to open the door? And then the light inside. Suddenly, there was no lights in the kitchen. It was normal, natural light. And suddenly I open the fridge and I look at those lights. And then there are a lot of things there. I again get confused. When I take, okay, somehow I take that water bottle out. It's heavy for me. I've not practiced lifting this much of weight. But yes, I'm thirsty. I take the bottle out. My fine motors are not helping me. My gross motors are not helping me, supporting me to open the bottle. I'm not able to twist my wrist to open the cap. Still, I try multiple times. And in this process, bottle falls down from my hand. Then again, you scream at me. You shout at me. Or if I'm able to somehow able to manage to open the bottle, you expect me to pour the water in the glass. But I'm so thirsty, I don't have time, patience to do that. And I just touch the bottle with my lips and I start drinking. Again, you are there to correct me or shout at me. And you're asking me to wait. Water is there in front of me. I have been thirsty for last 3 hours and I'm not able to control my thirst. And you are asking me to wait. Pour the water in the glass. A skill which I have never learned. A skill which I have learned, but due to this stage of thirst now, due to this pressure on my brain, I have. And you say, oh, you know how to pour the water in glass. You have done it. You can do it. Come on, do it. But the pressure of my brain, in my own emotional stage, my own thirst, my own need of the body is this time not allowing me to process whatever you are saying, not allowing me to process or utilize the skills I have learned previously, not able to recall those skills. My focus is on drinking water. And you call me impatient. That's where you say that this child is very impatient. You go back to the clinic and or the therapist and you complain them. No, child is very impatient. He doesn't have patience at all. And the therapist starts training me on turn taking, patience building, all those activities. But nobody has understood the root cause of my problem. I am not impatient. I have a lot of patience. That's why I'm still surviving in the world that is not designed for me. That's why I'm still trying to cope up with your rules, your regulations, social conditions, with those sensitive lights, with that sound of mixer grinder in the home every day, with the sound of motorbike, with the sound of those cars, traffic lights, or with those lights, signal lights, or the sound of honking horns on the street. And you call me impatient? You can't even imagine how much patience I'm keeping. Yes, I'm Chinu. This is my struggle, which I want you to address, which I want you to understand and give me the support there. So the conclusion is emotional health is as important as developmental skills. Without the emotional health, developmental skills, I will learn, I will forget. I will learn, but I'll not be able to use them when they are needed the most. When there is an environment which is giving me stress, all that I've learned, no matter how much I've practiced, I'll not be able to. And then you will complain, child does it in front of the therapist. Child does not do it at home. But you don't realize that at home, how much stress I'm going through. What is the environment? Early support prevents long-term issues. So stress needs to be handled as and when it comes. Accumulation of stress affects our cognitive brain, the cognitive functions of the brain. So we should not allow the stress to accumulate. We need to do stress releasing exercises. We need to do support the child, create a stress-free environment for the child. And every child needs understanding, not judgment. So we don't have to be judgmental about children. We just need to understand. When we support emotional well-being, we unlock the child's full potential. With this message, short talk today, but I want you all to think about it. Relate it with your children. Try to understand the stress they are going through daily. Start observing your child. Put yourself in the shoes of child and relate. Tasks are easy for you because those are made for you. Social norms are easy for you because those are made for you. And you have friends, you have people around who can take your stress, who can share it. I have no one to share with. Even if I have you, you expect me to share with you, but I do not know how to share it. So I have internal stress, the questions about myself, the complaints you have from me, your life I'm making miserable, the guilt of that, and I have stress from the environment as well because of my sensory difficulties, because of the competition you put me in, because of the expectations you have from me. I have the external stress also. So how to handle this stress, how to support our children? We will be discussing the stress management activities, what all we can do, how we can do the environmental correction on next Thursday. Same time at 8 o'clock we'll begin Indian time. But for this week, I want you all to relate. Replace Chinu from this story with the name of your child and relate with the struggles, whatever stage he is at right now, whatever age he is at. Relate it with the struggles, because the next session is going to be very useful for you only if you can relate with your child. So I just wanted to keep today's session very brief, walk through this visual story, which a story which I wanted you all to visualize. And I'm giving you a week's time now. Please relate it with your children. Try to understand their struggle from their eyes. Try to hear things that they hear. Try to process information that they process from the environment. So this whole week is for that. And next Thursday, I'll come back with the solutions, with the strategies that you can use, how you can make environment supportive for your child, you can make child stress-free, stress releasing exercises for the children. That also we'll be talking about. How to do the environment analysis, pre-planning before exposing the child to a new environment, and post-planning. After exposure to the environment, what all corrections need to be done. All of this we'll be discussing in the next session. That is on next Thursday, again 8 o'clock to 9 o'clock. That information will be given to you all in the WhatsApp group. I hope all of you are already part of the WhatsApp group, which we have for webinars. Now, these webinars we conduct every Thursday and Sundays. So Sundays already there is a series on autism lifespan management going on. So the topics are there. And Thursday we are taking different topics that I need to address. These are free of cost webinars. So there is no charge for joining that group. Group joining link can be shared with you all. I think you all have received this um, invitation of today's message through WhatsApp or through emails. So from where you have received this, at the same place, you can just reply that you want, if you are not part of the group, you want the group invitation link, and the link will be sent to you. So via email or via WhatsApp, you can just reply to that message and we'll share the link of group joining with you. I think there was a message circulated today in which group joining link is already there. So you all can join the group. My YouTube channel has more videos about behavioral communication, about challenges children with special needs face, how to handle those challenges, how to overcome things. So you can go through my YouTube channel also and see the videos which are publicly available. You may relate, they may be beneficial for you. And I'm available for the consultations, one-to-one consultations as well. So if any parent wants to connect with me, yes, those consultations are on appointment basis, and there is a small fee also for that. But any parent who wants to connect with me for a detailed analysis of child's conditions and supportive plans, supportive therapies, what we can provide as a parent, what you can do for your child in please feel free to connect. The coordinators will support you and then we'll fix up an appointment. So one-to-one discussion we'll have through a Zoom session. And on basis of that, I can support you via some home plan or via some suggestions and guidance, what we can do for our children. That's all from my side for today. Thank you very much for listening to me. And now I'm open to the questions. Let me see if there are some questions already in the chat. If you have any questions on YouTube, you can just put your questions, please. So group chat link, my coordinator is saying that has already been shared with you all in the chat bot also. So you all can join the WhatsApp group. So you will get the information about next webinars. Coming Sunday, we are not doing a webinar due to some of my personal reasons, my availability issues. So coming Sunday, we'll not have a webinar. But next Thursday, we'll have on the same topic, but strategies and management of children's stress and depression. We'll have that. Yes. Any questions? I'm open for them. As I said in the beginning of this program, with this seminar, but webinar, sorry, I want to repeat that Aspire is a new project which JKP Care Foundation has just started begin with, and this is Aspire is a online schooling program at a very nominal cost, online schooling for children with autism, specifically for children and adults who are on spectrum, that is for that. And in Aspire, we have team of trained educators who will be connecting with the therapist. So it's a module where therapies and education will continue together in online mode. And 9 to 1 are the timings. Indian time 9 to 1 are the timings for the school. From 1st of April, we are starting and admissions are open. Anybody who wants more information about it, you can go to our website, that is www.jkp.ngo. And Aspire project is listed there. You can understand. Okay, any other questions anyone has? Shraddha Basnet says, thank you, Dr. Alok, for wonderful session today. Waiting for some stress relief exercises next session. Yes, Shraddha, definitely we'll be discussing about the next exercises. And any questions you have or any feedback you want to give, you may please just type in the chat box. So usually the sessions which are on Sunday, we do it on Zoom. YouTube Live is also there for participants who don't want to join on Zoom. And there we have face-to-face question answers. And Thursday sessions are, because I understand Thursday is a busy day, working day for you all. So Thursday sessions are time-bound sessions, 8 to 9 only, 8 p.m. to 9 p.m. And we just take some questions if they are coming in the YouTube Live. So if there are no questions, I think we can end for today. Again, I want to leave you with this question: what all struggles related to stress my child is going through? Make a list of that, whatever comes to your mind. Observe. Observation is the key. Observe your children in different situations, relate it, try to understand. As I've given you some examples, like um, taking water out from the fridge and drinking on his own. Likewise, observe them in every activity they do, taking shower or brushing their teeth or wearing their clothes. Just observe them, and you will understand where the struggle is, what is stressing them, what is causing the stress. Observe their environment, observe how people are behaving with them. Are they feeling left out? Where they are feeling left out? All of this, how neighbors are behaving, how other children in the school are behaving with them, what is the behavior or expectations teachers have from them. All of this you need to observe, make a list, then you will be able to relate with the strategies that we discuss next Thursday. And looking forward to, I know today we all are, even I am kind of emotionally stressed after narrating this story to you. So I'm sure as parents or as therapists, most of you might be feeling connecting with the Chinu story and Chinu's life, and would be a little down on emotions. So I know, I mean, this is what was the agenda of the session today. So let's meet again with the strategies. Do not make this your space. You just need to observe, and we have the solutions. Do not worry. Solutions are there. We will find solutions within the challenges that we are facing. Within the challenges, we will find solutions. So next Thursday, we'll be discussing about those solutions. All right. Thank you then. Thank you, everyone. Wish you all the best. Happy Eid in advance. Eid is coming, and today is Navratri, or today is the first Hindu as per Hindu calendar. It's the first day of the year. So Happy New Year, Happy Navratri, and Happy Gudi Padwa. In Maharashtra, we celebrate it as a Gudi Padwa, and Happy Eid in advance. Wish you all the best. Enjoy the festive season, and see you all on Thursday. Bye bye.